Welcome to Medical Confessions,
your remedy for serious medicine. I'm Jen.
I'm April.
And I'm Scott. Today we're going to be talking about broken heart syndrome, and can you actually die from a broken heart?
Before we start today, I just want to let everybody in the world out there know how disappointed I am with Scott. We offered coffee and tea before we started. He said, no, I got myself a beer, and this is what he chose.
A little Bud Light. Yeah, this is America's #1 beer.
I don't hate Bud Light. I really don't. I just thought it was funny that you've been craving a beer for like a week, you said, and then he goes to the store and he comes out with a Bud Light. So what exactly is broken heart syndrome?
Broken heart syndrome is, so the technical name is Takotsubo. Octopus and a pot. So it's Japanese tako is octopus and tsubo is a pot.
Huh.
And the reason why it's called that is because the left ventricle of your heart looks like a fish trap that they would catch octopus in on the echocardiogram. And so they said, it looks like that, we're just going to call it that.
Oh, so what is it?
It is an acute cardiac disease that mimics a heart attack. And so you'll get chest pain, you'll get shortness of breath, and it feels like a heart attack, and actually all the hallmark signs of a heart attack are there. And one of the problems with diagnosing it is it can look like a heart attack. Sometimes you get elevated enzymes that you would get with a heart attack, so troponins and CK and CKMB, which is some of the enzymes they check for, and you can get ST elevation, which is an electrocardiogram symbol that says that your heart's dying. So you can get that with it. The only differentiation is there's no blood flow problems. Usually a heart attack is caused because you've got a blockage somewhere, either the vessel burst or you've got a clot in there. Here, that's not the case. And plus you get this hallmark left ventricle weakened problem that gets this ballooning look to it. And if you see that ballooning look, they say, boom, you've got Takotsubo cardiomyopathy. So I'm just going to call it TS, so I don't have to keep saying that word from now on. Before 1990 and 1991, this problem was known that there's people out there who get really depressed for some reason, or really, their loved one dies, and all of a sudden they have this heart attack. And so they classified it as a bunch of things. Well, in 1990 and 1991, these two researchers, Sato and Dote, found this hallmark left ventricle problem and said, okay, this is what it is. This is what we're going to call it. So is the broken heart syndrome, you said that that's not a blood flow issue, so is it less fatal than maybe heart attacks are? The chance of dying from it is really low, but you can, and it's the complications you get from it that are probably killing you. Okay. But most people, actually, it's a very acute thing that it comes on, usually within a few hours to a week or so, it all kind of, resolves itself. Okay. And the problem is in that acute phase where it's happening right then and there, you can get problems with your left ventricle, you can get blood flow problems, low blood pressures, you can, get, so if you have a left ventricle that's not pumping right and your right side is pumping to your left side just fine and your left side's not pumping out, you can get fluid in your lungs, you can get edema places, you can get low blood pressures, you can get lots of things that can then eventually kill you. But the problem is this left ventricle weakening thing. But the dying of it is pretty low.
And what's the time frame after someone dies? Is it fairly quick, or does it vary for different people?
That's a good question, and the studies are kind of all over the place on what causes it, why it's there. What they can say is that 70% of the people who have this will have an inciting incident. 26% of people, it'll be an emotional upset. 36% of people, it's a 36. Well, I say that because a small percentage of the people, sex can bring it on.
Poor sex? Like, is it supposed to be like a sad thing, like depressive? Well,
so people with this left ventricle issue, like I just said, 27% of the people, it'll be emotional trigger that triggers it. 36% of the people, it'll be a physical trigger, like you've got a brain bleed, basically, that causes intracranial pressure. That could cause it. Sepsis can cause it, so a full body infection. And then a smaller percentage of the people, a sex act or just being pregnant has been shown to cause it, but these are low percentages, right? It doesn't happen very often.
Right. So the broken heart name is actually a small percentage of the people that actually display these symptoms.
Correct. 27%.
Yeah. So
So that's
1 out of 4.
Yeah.
Of them.
25, ish.
And if I read a little bit too, and it was talking about death of a loved one. Yeah, a little bit. Well, I never read as much as Scott does for sure, and I never have the YouTube damage that April does on everyone. But it made me to believe that it wasn't just death. It could be all kinds of events. Maybe a spouse that has diagnosed with cancer, or all kinds of different things. So not just generally it sounds like more of a depressive thing. So is this a hormone issue?
Well, and this is where we're going to talk about a lot of specifics, so might bore some people, but no one really knows specifically what causes it, because some studies say this, some studies say that. So there is the general 4 classes of things that it could be. One of them is a cardiac ischemia problem. So you're not getting enough oxygen to your blood vessels for some reason. Either you're getting coronary vasospasms, so the arteries in your heart are just kind of spasming, but that only happens 5 to 10% of the time. One of the studies said this is happening, so people said, okay, it's a coronary vasospasm problem. Well, then they looked at that, and only about 5 to 10% of people have that, so that's probably not it. It could be a microvascular dysfunction. So a lot of the tests out there that they give to look at heart vessels, they can't see those tiny little arteries. And so the theory out there was that it was these tiny little arteries not supplying enough blood to the heart. And that could be the problem. One study said it was, one study says it wasn't. So is it? Who knows? But some people did have it. Another study looked at left ventricular output or outlet tract obstruction. So trying to push blood out to your heart from the left ventricle, there was an obstruction somewhere. Only 25% of the people, actually that was a problem. But 25% of the people it was, so is it that? Probably not. When you start talking hormones, the vast majority of people have what's called excessive catecholamine release. So things like epinephrine, norepinephrine, dopamine, these are all catecholamines, they're neurotransmitters, and they get released when you have your fight or flight nervous system, or when you get upset, or, being, anguished. Is that the right word?
Sure.
For when your loved one dies? So you get this problem, and 70% of the people will have higher blood levels of catecholamines, so they're thinking, well, that might be the cause. The problem is some people don't, and they still have this problem. So is it the catecholamines causing it, or do the catecholamines then trigger something else that causes it? Who knows? But you can also, people with something called Pheochromocytoma, and that's a tumor on your adrenal glands that secrete too much catecholamines. People who have this, that will cause this TS syndrome, and people who have this tumor are more prone to getting recurrent episodes of TS. So clearly catecholamines are a problem, but who knows if that's actually the cause or not.
Sounds like there's a lot of rabbit trails you
Yeah.
had to go down to.
Oh, and they're still going down them because nobody knows.
That'd be frustrating for me. I'd end up saying, forget it, I don't care.
I don't care. Your loved one dies, it's just going to happen.
Well, and
Be
isn't
careful.
it true, though, that the ones, and we'll call it the true broken hearters, so these are the ones that have an event that they can identify happened prior to their symptoms, isn't it true that they're unlikely to have it happen again?
Yeah, it's a low percentage. So let's just throw some percentages out there. So
throw some percentages out there, April. Like a baseball player.
Well, the overall reoccurrence is 1.2%. In 6 months, so super low. Of the people that have it, it's really low percentage. And so people who get admitted to a hospital for acute coronary syndrome, which is that class of cardiac problems, overall, it is 2% of those are actually this true TS problem. If you just factor out men and only count women, it's 10% of women, because women aged 65 is the average. 80 to 85% of the people who have these are women aged 65, or in that age group anyway.
So you're less likely as a younger, healthier person.
Correct.
Okay.
Yeah, and the vast majority of people who have it are women, and 80 to 85%. That's pretty much most of all of them, and they're all postmenopausal usually.
Oh, things to look forward to, April.
Well, one of the articles I read, I just looked up and Googled people who died of broken heart, and I don't know if they actually have the medical background to back these up, but they're saying Johnny Cash died died 4 months later after June Carter.
Aw.
And they're suspecting that was from broken heart syndrome.
Well, that would make sense because he was super into her, I feel like.
Yeah.
That's what the movie led me to believe.
Sure.
Yeah.
Yeah. I have one personal story about a male passing shortly after his wife. And I was working at a nursing home at the time. And he actually didn't even need to be in the nursing home. His wife did. And he moved himself in. And she didn't want to share a room with him.
Oh, he wanted to be with her, and she...
Yeah, so they had separate rooms, which is super pricey.
Yeah.
I mean, but he
She was so annoyed. She was like, I have been waiting to get away from you.
was very high energy.
Yeah.
And I mean, he was a joy to be around for me because,
You're high
I was healthy and she wasn't.
Yeah.
So I could see how that would be a drain.
Yeah.
But they would eat breakfast, all their meals together. He would just get himself up and wheel himself into her room. And when she died, he died like a couple days later.
Ah.
And like I said, he didn't even need to be in there.
Well, this makes me wonder because there are some couples where it's like the one person's like, if he dies, I'll be fine. And then the other person's like, if she dies, I'm wrecked. Or him.
That will happen with my husband and I. Guaranteed. And not because I don't love him, but... I just think that I'll just keep moving on and he'll be destroyed. So I hope that he goes first. No, I'm serious. Like, he will get broken heart syndrome. Promise.
Yeah. Aw.
Right? April?
Mhm.
Swear.
Yeah.
Yeah.
I see.
Sorry.
There's nothing wrong.
But that's just, like
There's
different
nothing wrong with
personalities.
hopeless romantics.
No. Well, and so it makes me think, though, especially with the older people, so family members that I have that are older, and actually even a neighbor now that has had some interactions with Dave and I about a neighborhood thing, really super hyper focused on something that to us seems very trivial, like a minor issue, and 5 phone calls in a week over the homeowners association meeting. Like, not even like, we'll be there. I don't need 5 phone calls. But other family members that have gotten really stressed out over something that we're like, why are we worried about it? Is that age group more prone to have less, social interactions, less responsibilities and stuff, and so everything is so, I don't want to say exaggerated, that doesn't sound nice, but the death of a spouse to them, they don't have anything else to engage them, to focus on, and so is their stress and depression and everything elevated compared to maybe, and I don't want to diminish a 40-year-old that loses their spouse, but they've got kids and a job and all these things that they have to engage in. So are these older...
Can't focus on it.
Right. And these older people that are maybe in a home and that was their world. There is nothing else to divert attention. So are they more likely to be...
Well, and actually, depression and anxiety is an increased risk factor for it. And it's all risk factors because no one knows for sure what causes it. We just know what to look for it. And
Right.
to say you have it, you have to rule out that you had a heart attack or that you had some sort of other problem. And once you rule that out and you get that echocardiogram and they see that bulging of the left ventricle, well, cool, you've got that. Treating it, actually, there's really a funny story on treatment. There's been no prospective study ever done on a treatment regime for it because it is so all over the place. What causes it? And it isn't very common. It's pretty rare overall. So trying to come up with a treatment guideline, there just isn't one. So
Right.
Docs are just forced to treat the acute problems that are happening right now, keep you from dying, and then we just know that within a week to a few months you're going to be back to normal and you'll be fine.
That's kind of sad.
You'll be fine. Rub some dirt on it.
Well, it just seems like the physical presentation of what somebody emotionally goes through with a death, or what many people do. So it's kind of just interesting that it's like,
Well, I think it kind of bleeds into like stress in general, right? Like, I can't think of a single president in the last 50 years where you don't see the before and after pictures, and you can see that stress causes problems long term. And it's that excessive catecholamine release over time that causes these problems.
Sorry. I'm thinking about our current president, and I'm like, we probably won't notice anything.
I feel bad saying this on camera, but actually I thought, I hope the stress gets him, like at some point, and he's got to quit. That, not that he dies, but just like, what, for my health, I've got to quit. Because, he's super old.
I think April's right, though. Like, I don't think it's affecting them the same way that
because misogynists just don't care.
I don't know.
Anyway.
I do have another sweet story. This is a woman who died of a broken heart, but And I'm going to read from the article because I don't want to mess it up. Clifford and Marjorie Hartland. They were 101 and 97. Clifford had been presumed dead after World War II, but Marjorie had refused to believe that. Her faith was later rewarded when he returned from the field, one of only 4 men from his 700-man regime to return. The day that Clifford died, Marjorie spoke to her daughter, telling her, "I can't live without him." She died hours later on the day of their 76th wedding anniversary.
Aww.
Wow.
That makes me feel sad for you. See that movie Castaway?
Yeah.
How depressing is that? That like that was the one thing getting him through was this lady, and then he comes back, she's married to somebody else.
Yeah.
Oh.
Have you never seen that movie?
I think it was too slow. I started
It was very slow.
It is
yeah,
slow.
and I was like, meh.
Well, there's hardly any sound.
Yeah.
There's just, him acting.
Yeah,
and
lost
stuff. I
my
loved
attention
that movie,
span.
but yeah,
Yeah.
I wanted to slap Helen Hunt.
Yeah,
Oh
I'm like, what are you,
man.
little hussy?
But I would be Helen Hunt.
Yeah. I'm great. He's been gone for a year. I'm
I
good.
gotta move on.
Oh, man. That's
I
terrible.
want to hug Dave right
Now
now.
I kind of...
I don't mean it like that.
I know you don't. It's just funny. Well, so funny story. So it's catecholamine release is a problem, right? Like 70% of the people have this excessive catecholamine release, so it's clearly a trigger, and emotional stress can do that. But I have a funny story about a time that I told somebody he was full of crap, and then it turns out he was not full of crap.
About this?
We talked about physical triggers can cause it. So intracranial pressure with head bleeds, and so I was in the back of a rig with another person we work with, and this person clearly had a head bleed that was causing intracranial pressure. Her blood pressure was jacked, heart rate was low, she fell, hit her head on blood thin. Everything said she's got a head bleed. Turns out, we looked on the EKG, she's also having a massive MI, or a massive heart attack.
Oh, my.
Oh, how can that be? That's weird. And I'm like, that's pretty unusual. That one of these is not fitting right. And he says, she's got a neurogenically stunned myocardium. And I was like, you just made that up. Like, you just threw a bunch of big words together and made that up.
Yeah.
And he's like, no, serious. And I'm like, I don't believe you. You're full of crap.
And it was.
And so we get to the hospital, and we go in, and so, we kind of talk about on the way, and I'm like, I don't see how a head bleed is going to cause a heart attack. It doesn't make sense to me. Like, it just doesn't. And so then we show up, and we're talking to the doc, and we present both problems, and he's like, oh, and then he goes, hey, doc, do you think it's this neurogenically stunned myocardium? And the doc looks at him funny and goes, I'm calling the cardiologist. Like, he wasn't even.
Yeah.
And I'm like, see, you're full of crap. And I think he started to doubt himself.
Yeah.
But then we started looking it up, and I'm like, oh, he's dead on. That's right. And it is a person you need excessive catecholamine release to keep blood flow to the brain when you've got pressure there, because you need your blood pressure to increase, so you need those catecholamines. Well, if it happens for long enough, you can also cause this Takotsubo problem. And so that's what was happening to her, and I told him he's full of crap, and turns out he wasn't, and I had to.
But at least it was a cool thing.
Yeah.
At least, and you had a doc backing you up. Like, the doc was also like...
I felt like,
Yeah.
that's when I knew I was right. I'm like, see, ha!
So even if you're wrong, it's like, oh, well, okay. At least I'm in good company.
Yeah, we're all full of crap. Anyways.
So, broken heart syndrome's a real thing.
It is. It can happen. Like, what was that? The Notebook.
I think I watched a clip of that or something. It was too
You've
mushy.
never seen The Notebook?
Too mushy for me. Like, it was over.
I liked it.
Yeah.
I shouldn't say that I liked it, but I actually thought it was a good movie.
I think I understand the general idea. It's like a couple that he loved her or whatever, but then doesn't it, like, at the end of it, like, she's in a nursing home or something, and...
Well, yeah, and in the beginning of their relationship, she's trying to pick between two people.
Okay, yeah.
Basically, they fall madly in love, and they end up spending their life together at the end of the day, and then she's got Alzheimer's, and so this entire story is him reading their life story in the hopes that she will remember him.
Yeah.
And then every now and then she does. But, and then finally she dies. Well, he dies in her arms that same night.
I'm not a big chick flick movie. I liked the movie, but it's
Was it
bunch
Ryan
of
Gosling?
crap.
That's how I always view those kind of movies. I'm like, yeah.
Setting females up for failure if they truly believe that. I mean, oh sure, there's a percentage of life stories that do happen that way, but come on.
That's everyone's goal, though, right?
True
To
love.
have that sort of
Yeah.
relationship.
Right.
Sure. I mean, well, Jen clearly does, so
No,
she doesn't have to watch stories like that.
That sounds so mean. It sounds like I don't not love my husband or doubt that we have an amazing relationship. It's just I'm one of those people that I won't allow myself to get depressed or get emotional. So if something ever severe happens, I'm like, cut it off, move on, step forward. So
Dead to me.
no, literally, no. It's just like if something like that happens, I won't let it. I will force myself to just get over it, no matter how devastating it is.
I think on one level you want the person to move on and be able to be happy and not depressed, but on another level you're like, I really hope they are.
And don't get me wrong, I won't move on. Like I will probably
overnight.
No, not even
Yeah.
that. Like I am too set in my ways. I'll be like, no, I'm not remarrying or anything. I don't mean that. I mean like I'll be like tomorrow. House is getting cleaned, going for a run, making sure, I'll be that kind of focus. Like, I'm not gonna, so,
Yeah.
but.
We're totally making you sound worse than you are.
Oh, well, good. Well, if you liked what you saw or heard today, check us out on YouTube or our podcast.
Or visit our website, medicalconfessions.com.
I hate scary movies.
So you got
Me
pick scary
too.
movie
Yeah.
ones.
Like,
The
I
dark?
just don't, I just don't like scary shit, period. It annoys me. I have no control. Kind of.
Yeah. Dave's gonna be crushed when he hears this episode. It's all a facade.
He's used to my wholeheartedness. This is not news to him. I'm a lucky woman, is what he tells me 75 times a day. I'm gonna have to make sure Dave doesn't watch this episode. He's
Edit
gonna,
appropriately, April.
he's gonna
Be
be like,
careful.
Jenny. He has no idea how much that hurts.
Oh. Yeah. Oh.
Oh. Anyway,
He knows.
he knows.